Welcome to this edition of Spirit RX Podcast, Ancient Wisdom, Modern Healing. I'm Dr. Michael, naturopath extraordinaire.
There you go.
That's
Own
the
it.
naturopathic physician. This is Dr. Luke, quantum chiropractor. We love to integrate best practices of modern medicine with ancient remedies and modalities. In this podcast, we'll explore contemporary health and wellness topics with a blend of wisdom, humor, and practical tips for the everyday person. I am reading right now, just so everyone knows. If you want to learn more about stories, our businesses, and how to connect with us, please click on the video links below to learn more about us
Yeah,
individually.
awesome.
So today we're going to be talking about what?
Yeah, let's talk about placebos. That's a very loaded, controversial term. Placebos. I think in general, everybody has some idea about what it is, but let's dive in and pull it apart and see, is this a good thing? Is it a sham? Should we avoid it? How would this relate to medical practices today? Let's jump in. So, Dr. Michael, tell me, just start by just some general definition with placebo. What's it all about?
So, generally speaking, what a placebo refers to is the effect that occurs that is positive
Okay.
based upon something that should not have that effect. So
Okay.
there's no physiological known effect that's happening from the medicine that you're giving, but they're getting a benefit from it. So that's considered the placebo effect. Does that make sense?
It does. We'll give our audience an example because this is a great thing to put into research. People love double-blind research projects for the sake of validity, but in science we love that. So how might a placebo show up in a research project?
So whatever they use in the research project, and this is the difficulty of placebo,
Right.
they want it to have no mechanism of action.
Right.
In other words, it's inert. So when they take it, there should not be anything that happens in the body that
Okay.
would be affecting them in a positive way. The problem is with that is that most things affect us in some way. Even inert substances, we think that they're not going to have an effect, but they can.
Okay.
And so that's the first thing. So example would be like the typical examples, they use a sugar pill instead of a pill that actually contains an active
Okay.
drug or substance. So that's a placebo effect, a positive
Okay.
response to something that shouldn't have that response, supposedly. And then the opposite of that is something called the nocebo
Okay.
effect. And I think it's important to point that out because you also can have a negative like outcome with something that shouldn't have that kind of like no
Right.
mechanism of action towards a negative outcome. So I think both of those should be discussed when trying to understand the placebo effect.
Okay. I guess an example that I would think of is, let's say a drug company comes up with a new drug treatment plan for, it doesn't matter, asthma, depression, let's say depression. And so they want to test this and see how it works. They can randomly put people into two groups, give one group a placebo, a sugar pill that obviously should have no effect
Mhm.
on a person's state of depression. And so they take the metrics before they administer the pill, whether it's the real new one or the placebo one, and they look at the results and see how that comes out at the end. So, in theory, in pure theory, if you have a positive action from this particular new drug, you should see some changes for the good if that drug is effective. And then you should see no change if the sugar pill was in that group. However, that's not always what happens. So when we
Mhm.
say placebo effect, then the group that's taking the sugar pill, some of them might also show a positive outcome.
Yeah, I think it's important to recognize how much the placebo effect is part of like
Right.
medicine and science in general. So when you do a controlled trial,
Yeah.
the idea is that you're going to provide an intervention, and then you're going to have a group that doesn't receive that intervention. You're going to have a
Right.
group that thinks they received the intervention but
Exactly.
did not. And then that way you can, based on that group that thinks they received it and the group that did not receive it, you can determine how effective the actual
Yes.
treatment is in the group that did receive
There
it.
we go.
Yeah.
I know when I've looked at this topic just historically, let's just say just in the United States, but United States, Europe as well. 2 centuries ago, the use of placebos by a typical family physician was pretty standard practice. So, in their black bag of medicines and things that they would take as they do their rounds and make visits to people, they might have a little bottle of sugar pills, for lack of a better word, and they would have a certain name for that. And if they had a patient that they've been working with that they just needs a little bit more time for the treatment to take its effect, and the placebo might just be something given to help bridge them through that time period while they're waiting. So it creates this positive effect that I'm doing something about my health problem. And so I think placebos were a pretty common part of the arsenal for a medical doctor in the past, less so now because I think today we have more concerns about, is this ethical? What do you think about that? Is it ethical for a modern doctor to issue a placebo? Let's say you have a hypochondriac patient. And so you've worked with them a long time, and they're just always something's going wrong, even though there's no clear supporting symptomology to go with that. Should a modern doctor use a placebo?
The difficulty with evidence-based medicine outside of the research setting of what we've developed for medicine in our country recently. And I mean that recently. Like it used to be that it was acceptable, more acceptable for a physician to basically say, this is a therapy that I think could be really beneficial for this type of patient population. We
Okay.
don't have any current therapies that we know for sure are available. And we still do that to a certain extent, but they'll do it. And then part of their experimentation with the patient and understanding the responses they were getting were the
Right.
use of a placebo. The problem is that the use of a placebo, as much as we want it to be an inert thing, is in fact a very powerful treatment.
It
And
is.
that's for me, that's why I think we should still be using it because I
Right.
feel like if you can give something to someone that does not harm them and only could possibly provide a positive effect
Right.
just based on their belief around that thing, why would we not allow
Yes.
physicians to do this? It's crazy not to do that because we believe that it didn't have the effect. So, in a sense, we're creating the nocebo effect for everyone out there, which is why I'm just going to throw this out. I know it's
Okay.
controversial, but why I believe that the majority of medicine practice in this country today is actually fear-based medicine that is
Right.
leading to worse outcomes with people because of the expectation of effect that we're providing our patients. In other words, we have a fear of taking responsibility as to how that patient's going to respond. We don't give them a positive possible effect with the placebo given to them with it.
Right.
Hey, this could do great for you. It might work. It works 30% of the time. Now, immediately that patient's may not work for me.
Well,
Which
yes.
side are they gonna go on? So we really, I think we harm patients with that approach. Even though we try to see things mechanistically, the world does not work
Right.
in a Newtonian mechanistic way.
Agreed. And you said a key word a couple of times, which is belief. And what the patient believes is going to happen is so important.
Mhm.
So the belief is super important to what the outcome is going to be. So let's dive into that a little bit more. Now, in our Western culture, we tend to take belief and say, oh, that's the category that we would want to push over to psychiatry, that medicine is science, that's separate from belief. But I don't think you can separate those out.
Mhm.
And there's actually so much in research now that's showing that how powerful the mind is, that if the mind believes something, then it creates that. And so that the effect of the mind is so powerful that then, in essence, the placebo has the power that the mind gives it. There's no difference between there's a difference, obviously, but the effects can be identical between the placebo and the actual pill or treatment that's going to happen. I know a classic study that I learned when I was in medical school, and I don't have the citation for it, I'm sorry, but this was back when heart surgeries were first coming up on the scene. And they took, I think there were about 20 patients that were needing heart surgery, heart procedure.
Mm.
And so they did what's now called a sham surgery. Sham meaning they didn't really do the surgery. What, in essence, then half the group randomly got the surgical procedure, and the other half, they just made an incision and put the stitches in. So when all of the patients come out from being under anesthesia, the doctors would say, it went great. The procedure went great. You're going to be fine. We expect you to recover soon. It might just be a little sore for a while, but everything went great. The results were almost identical between the sham surgery and the actual surgery. So I don't know if we would actually replicate a study like that today, but we do. Some research topics today will involve a sham surgical procedure because there's just so much evidence that the effects are positive even without actually doing the procedure. So we as human beings, I think that we want something to happen that makes us feel like a change is occurring. So taking a pill, having a surgery, having maybe it's a shaman say some words over us. We need something to grab hold of in our psyche that the healing is occurring. The healing's already there in the body, but we want it to be amplified because we need that extra intervention.
Yeah, I think that it's important to recognize how prevalent that is within study creation. Like sham is still used.
Yes, it is.
Yeah. And interestingly enough, one of the things that I see quite frequently is there will be an effect that occurs with a control group, right? In every step, most good randomized controlled trials, where they have to actually take into account the percentage of people that got better
Right.
with no known intervention that would have had that effect. And that typically ranges, and I've heard the ranges before, up to 30%. And so this is actually a conversation I have a lot with my patients, which I
Okay.
love to share.
Okay.
Is one of the things I like to talk about is, okay, you're sick. You have all these things going on.
Right.
Here's a bunch of categories of different things that this could be associated with. But one of those that people are often marginalized with is it's all in your head, right?
Right.
You hear that all the time. Oh, they're just crazy, right? This is,
Right.
and people hear that, they feel that, they don't like it, they
Right.
hate it, and they typically have a very strong aversion to anything
Correct.
that could say that this is a mental problem.
Yes.
And typically, I tell them that is the easiest cop out method that any physician can use when they say it's all in your head, because everything's all in your head.
Yes, it is.
Everything, the way you perceive the world. So, what I tell them is, but that doesn't mean that we can't apply the benefits of the placebo effect to our procedure, to our intervention. And what that means is we can get upwards of a 30% improvement in your health just by believing you can. And that's what I try to like really emphasize is that, listen, you've gone through a lot of things. Don't expect those things to have the same outcomes.
Right.
Even if we use the exact same thing again, then they say that's the definition of insanity,
Right.
right?
Right.
But I
Right.
don't care. Be insane, but be healthy and be happy, right?
Be a little
Insane
insane. It
people
could
are
make
happy,
you more
right?
healthy.
Yeah. Anyway.
And I think older cultures would have, there's different names, of course, but medicine man, shaman, etc. But many cultures would have maybe two-person role where one was more ceremonial and the other was more what we might call the medical part, where the herbs, the treatment,
Mm.
the diagnosis. And so both of those would work together because you can't separate your belief and your mind from your body. And when we do that, I think that's where we get into trouble. But older cultures, that was a very common thing. And so to have the shaman come perform the ceremony. There's an action that's occurring. There might be some kind of an herb or a medicine that's given in addition to that. And there's a procedure then that the person goes through, and then their mind, their spirit, their body are all contributing towards the aim of this healing process. And their family and others from their tribal group would be there to also support them in this journey. And it wasn't just a 5 minute visit like at the doctor's office. This might be a multiple day event.
Yeah.
But that interconnectedness is what we need to return to get to our best health outcomes.
I love that. And I also, just to piggyback off of that, have recognized that there is a power in ceremony,
Yes,
in the act that represents something to you, that creates something that you're desiring in your life. It's an act of creation, it's an act of ceremonial belief that then connects to that faith that you develop around that thing. So you can make anything a ceremonial act if you want to.
right.
Even taking your daily medication or your whatever the medicine
Okay.
is that you're taking. Let's say you're taking ginkgo biloba, right?
Okay.
For your memory, right? So our goal is to improve memory. And we understand that, yeah, in the studies, there's a certain amount that a person would need to take in order to improve blood flow and
Right.
therefore improve cognitive benefit. But you can take that and you can set that little pill out at a certain time every day. And you can think to yourself, I already feel better. I
Right.
already think better. I already see better. I've noticed that I'm able to think better than I have before. Maybe you look in the mirror and you say that multiple times in the
Yes.
mirror. And then you take your pill with your, it's almost like you're imbuing that
Right.
that capsule with your expectation.
Yeah, that intention's
Yeah.
huge. Hey, there's a movie that I was thinking of that ties in with this topic, very
Hmm.
thought-provoking. It's called The Farewell. A really cool movie. I'd recommend people check it out. Basically, there is a Chinese family with a grandmother that's very ill. She goes to the doctor and finds out that the doctor tells the family that she has this terminal condition, and there's an expectation of X amount of lifespan left. The conflict then is, what should the family tell grandma? And in the tradition of this region, it was common that you don't tell grandma she has a terminal illness. Instead, you say positive and you keep that negative out of the conversation. So enter a granddaughter that's living in the West that's now in this discussion with her family, and she's feeling this ethical pull. We should be telling her the truth so that she can make the most of the time she has left. And the family's saying, no, we shouldn't. And she's saying, yes, we should. So they have this tug of war over that concept. What they end up deciding to do is sticking with tradition and only telling grandma things are going great. The tests are showing some positive things. There's a family wedding coming up in the near future. Let's put our energies into that. Keep going with your Tai Chi and your exercise and getting fresh air. And you should be good to go for a long time. So that's what they decided to do. I don't want to tell you the end of the movie to see how that works out, but you can probably guess by me mentioning it. I guess I'll just tell you, she does end up surpassing the initial prognosis by a considerable amount. And so that positivity, so, but should we lie to grandma? Let's be positive. Let's tell grandma that she's doing everything right and that everything's going great and let's keep going. That's an interesting topic to have as a discussion, especially for a family, because there's going to be an older family member that's got some problems. And how much information do you want to give them? How much truth do you want to share? And how much positivity do you want to share? It's a pretty cool topic to grapple with, and I think it gets into this whole basis of what placebo. Do we want to have a placebo effect for our family? Is this a good thing or not a good thing?
I really do. I lean on the side of believing that it's important to convey positive expectations to patients. But I do think that there also has to be a recognition of reality.
Yes.
And so there are situations where I think we have to tell people like, hey, or maybe it's an expectation. They need to know. They want to know.
Right.
They want to prepare whatever's happening in their life. But what I will say is that unfortunately, what we've done is we have taken pessimism and we've rolled it up into realism.
Yes.
And that isn't reality. Reality is sometimes bad things happen that we
Right.
perceive as bad, but there's always a little good in the bad, and there's always a lot of bad in the good,
Right.
or whatever, vice versa.
So how would you, if you do a lot of treatments with folks with cancer,
Hmm.
and this you're going to have a different conversation with someone who's got like a stage 1 cancer versus say a stage 4 when they're showing up to you. What's that conversation? How's that going to be different?
I always tell people, and I think they recognize this, and people really love it too, by the way.
Okay.
I typically tell them that I'm not here to be the bearer of bad news. And I don't have the capability, some people out there, I believe, do, to make predictions about the future and be correct,
Okay.
like
Right.
consistently correct.
Right.
I don't have that ability. I can basically say to them, here's the percentages based on research,
Right.
but you don't really fall into this category. There's a lot of other extraneous
Yeah.
variables that
Yeah.
make it so you're not really this. So what I'll do is I tell them, you're not here to have me give you bad news until you're going to die. That's not my role. That my role is a healer. My role is to give you, I can give you percentages and share those with you, but my role is going to be I expect the best. I expect the
Right.
best possible outcome. And I will keep doing that until the day I die because I've seen way, way too many patients.
Right.
And I'm getting on my high horse, hopping up there. So I've seen way, way too many patients go into the hospital where they're hit with pessimistic realism
Yes.
and they die very shortly after.
Right.
And it wasn't needed at that time. Not to say that they wouldn't have passed at some point anyway, or that they may have passed during that hospital visit. But I think it's really important to recognize that we influence the outcome of our patients as physicians when we look at them and we tell them, sorry, give up, go home,
Right.
bye. Like that's, you don't have to do that.
Yeah, so a physician
So
there's some
stepping
authority
down.
behind the words that come out of the physician's mouth, and those need to be couched in as positive of terms as can be. And I think that the belief from the physician that's shared is super important. So if the physician's, this is going to be a tough road, but I believe we're going to do it. I've seen it happen before, and we're going to do it. You ready? Let's go. That positivity that comes from the physician, and again, you've shared the facts, you're not hiding it, you're not lying to them,
Mhm.
but that positivity and those positive outcomes, that great intention, you're the partner in helping this to happen. That goes a long way in a person's recovery.
I agree completely.
Another kind of a side topic, we started to get into this, but okay, for you as an individual, how do you grab hold of that placebo effect? Like, because sometimes we'll say, oh, that only happened because of the placebo effect. We're dismissing it that it wasn't real, but it actually had a positive outcome. You mentioned a little bit like looking in the mirror and having these positive things that we would say. I think that whenever we have something big or small, it doesn't matter. Let's say that I've got a skin problem and I've been researching it on the internet. I've gone to different doctors, physicians. I've tried a myriad of products, and sometimes it gets a little better and then it's still there. Sometimes a little better, sometimes it's still there. But then now I'm micro managing it. I'm monitoring it all the time I'm focused on what's wrong and I'm paying attention to that all the time.
Yeah,
Whether I like to believe it or not, I am reinforcing all my awareness is going to what I'm perceiving as being wrong. How can I flip that so that we're harnessing
mm,
positivity and not having that victimhood or ownership of this problem be part of who I am now? I ran across something recently that I thought is interesting, and maybe it's just the novelty of the name, but it's called the Dick method. So we said there was going to be some humor here, but now this is spelled DICCC. Okay, it's an acronym. So it stands for direct, instruct, command, compel, and code. And I first heard this from Marissa Peer. You can check this out on the internet, go to YouTube, and she'll explain to you all of this. But it's basically, I'm going to have a different conversation with myself and with my skin about what's going to happen. So instead of, oh no, here we are again, it's a conversation about how I'm going to accept things, but I'm also going to put this expectation that's positive out into things I say and the things I do. So I think that's a huge thing. If we can put a positive spin on that and the words that come out of our mouth and our thoughts, if we turn those into something positive, it can be so much, we can have such better outcomes.
I agree completely. I like the dick method. I've never heard that before. That's interesting. I think that I guess what I would say in that regard is what really is the placebo effect? Are we tapping into a power within ourselves? Are we tapping into a power outside of ourselves? Is it both? And a lot of people would consider false things, right, around like religious beliefs, and there's a lot of just negativity around that. But in reality, those things have power for us on an individual level. Whether we tap into something higher or not, that's a conversation for another day. But I would say that it's important to connect in our own way to our beliefs and recognize that we can have miracles. We can have incredible things happen that are not expected of others. Because one thing I will tell you over and over again is that others typically expect the worst for us,
Mm,
generally speaking, and sometimes even hope it. I guess the way I would put it is what we think about expands. If we change the way we look at things, the things we look at change, and that our thoughts really are things. They become our reality.
yeah. So let's tap into that, capitalize on mind, body, spirit, positivity, positive affirmations, best practices available. Surround ourselves with people who are going to support us and encourage us along that journey, and then expect for it to change for the positive. All right.
Awesome.
I love this
Cool.
conversation.
Take two sugar pills and call it.